Okay, so let's talk about your post-operative instructions after your shoulder surgery. It's important for me, if you can, to go over these before the surgery. That way we can address any questions at your preoperative appointment. If you haven't done that, then this is something you're going to be watching most likely when you get home after your surgery or even the next day. So when you get home, make sure you're using the cold therapy. This provides a pain medication assistance with analgesia support. If you're using the cold ice packs or frozen peas from the freezer, you want to do this about 20 minutes every couple hours or so. If you bought the cold compression device, then you can use this pretty much continuously for the next 48 hours or so. Take your pain medication as directed. Some of you may have had a nerve block, but this is going to wear off. So you want to stay ahead of things if you've done that. The pain medication is typically a narcotic. If you have problems with narcotics, please let us know ahead of time. How do you get comfortable? Well, most of our patients tell us that sitting up in a recliner with their arm hanging is the more comfortable position for them, so this is what we recommend. If you're going to lay flat in a bed, propping some pillows up under your shoulder can help, but this is a rest time. Wear the shoulder immobilizer or sling if you've been given one. If you've had a pre-op appointment and we anticipated your need for this, we have hopefully gone over this ahead of time with you. They are cumbersome, they're a little confusing sometimes when you get home. We will review how to wear it, take it off, etc. at your post-op appointment in a few days. So you've gotten to day one, you wake up. Again, this is a rest time, so this isn't the time to start planning Kings Island trips or trips to the flea market. So find a comfortable position and let's let your body heal for a few days. Continue the ice therapy or the cold therapy as we just discussed. And continue to take your pain medications. Don't get behind on this. Pain creates dysfunction, and dysfunction will slow your recovery time. You can add an anti-inflammatory at this time if you have no contraindications, and if you're not sure about whether you can or cannot take this due to medical problems, I want you to check with your family doctor. But these can include Aleve, Motrin, Advil. The benefit of these is that it can augment the narcotic pain medicine you're taking because it hits things from a little bit of a different pathway. So if you're having a little more pain than you anticipated, adding an anti-inflammatory on day one can be helpful. If you've been given an antibiotic, we want you to take that until they're completed. We're going to go over some home therapy instructions. You're going to start a little bit of this on day one. This is really just to kind of get things moving a little bit. This is not formal therapy, but just some suggestions on how to start mobilizing some of the soft tissue. So we're going to start with pendulum exercises out of the sling. You'll take the sling off. If you can bend over at your waist and just letting your arm dangle straight down like the gentleman in this picture, that's a good start. Then using your body, you want to try to get your hand moving in a circular motion without activating the muscles in your shoulder. To assist you, a can of soup or even a small 2 or 3 pound weight in your hand can help activate the pendulum motion. You want to get the circle going about the size of a large pizza, around 24 inches or 2 feet if you're measuring. Getting the elbow moving by just gently moving it up and down with your arm at your side can help facilitate getting some of the soreness out of the arm and mobilizing some of the fluid that accumulates after the surgery in the shoulder. We want you to start doing this day one as well. Let's try to get a squeezy ball or a wash rag in that hand. Start squeezing that again. This helps kind of restore the function in your hand and forearm, keeps things from getting stiff, and helps mobilize fluid through your extremity. So now we've gotten to day two. Not a whole lot changes, but today we're changing the dressing. So you're going to take the dressing down. You may see some fluid on it or even a little bleeding around the incisions. That's not abnormal. Take the dressing down. Take the Band-Aids that you hopefully obtained preoperatively and apply those over the incisions. We typically like the ones that are water repellent and seal all the way around, and you'll see why in a second. Continue your pain medication. Again, staying on top of your pain is important and very valuable to your recovery. Let's go back to the Band-Aids. By covering the incisions up, you can shower now. And I know you've been dying to do this, so let's talk about that. If you can sit, great. That keeps you from having to balance or going off balance if you get a little lightheaded or dizzy. Take the shoulder immobilizer off if you were given one post-operatively. And if you can purchase a cheaper sling out of a local pharmacy, that would be helpful to kind of keep your arm at your side. and then keep the spray of the water directly off the shoulder if you can. By now we've gotten to day 3, and let's go over some frequently asked questions. People want to know, can I drive? When can I drive? Well, as long as you're impaired with a shoulder immobilizer, you're taking narcotic medications, it's really not safe. There's no law against it, just as there's no law to drive blindfolded, but we don't recommend it until you're out of the sling and off narcotic medications. So at least until we see you back, no driving. How much pain should you expect? Well, shoulder surgery is painful. There's really no way around it. People don't anticipate that all the time, but kind of expect it. And if you're one of the lucky ones where it's not as bad as we anticipated, congratulations. But shoulder surgery hurts. Get comfortable, use the pain medicine, and use the cold therapy, and that'll help lessen things. I had a nerve block, what should I expect? Well, if you had a nerve block, the good news is you probably left the facility having not too much pain. The bad news is that sometime after your operation the block wore off and you probably wondered what the heck is going on. Well, nothing's going on, it's just the block wore off. The best way to manage this or to prevent a sudden increase in your discomfort is to stay ahead of the pain medication, use the cold therapy as we instructed. People want to know if they're going to need help after surgery. Well, we always recommend that somebody be with you for the first 24 hours to kind of observe you for any possible side effects from the anesthesia or the medication. After that, it's a case-by-case basis and will be based on your personal needs. If you know you're going to have significant issues at home, please let us know preoperatively, and we will try to facilitate getting you hooked up with our home health care team to kind of see what options they may have for you. When can I go back to school or return to work? Well, we always recommend that you give this 7 to 10 days regardless of the operation to kind of let things simmer down. It's a little hard to predict how people are going to respond, so anticipating going back to work or school in a day or two may not be realistic. However, if you're able to do that and you can work within the limitations we give you, we have no issues with that. We typically would like to discuss these issues when you come back next week for your post-operative appointment. When will I start physical therapy? Well, you're going to start therapy on day 1 with your home exercise routine. Formal therapy needs will be set up based on your individual procedure at your first post-operative visit. If we know for sure we're going to start it, we'll try to set these up ahead of time to minimize the downtime between the post-operative visit and the therapy visit. If you have a special place that you want to go, please let us know so we can set up the prescription for you. What about this follow-up appointment? Well, the follow-up appointment will be next week, or should be within the next week. At that point, we're going to take your sutures out, go over the home exercise program, review your pain medication needs, talk about your cold therapy, and basically review everything we just talked about in this video. At that time, we will also verify your post-op physical therapy appointment. You may or may not see me that day. Christy Bollinger, my physician assistant, and I alternate this clinic to go over the post-op instructions and to review your surgical findings. What do I do if I have questions? Well, call the office. You can talk to Shelley or get to Christy or get to me by calling 832-4773. And we look forward to seeing you back with a smiling face on after your surgery, and hope that everything's going to work out for you down the road and get you back to the functional lifestyle that you anticipate.